Hello everyone, and welcome to a video going over the things to consider before getting braces. I wish I had known all of these things 6 months ago when I first got my braces on, but unfortunately I had to learn them through painful and costly experiences. And I'm sure you've already noticed my teeth are really crooked, and that's also the reason why I decided to get braces in the first place, even though I am an adult. So let's start discussing those reasons. First, do your research. Brainstorm for a list of questions and concerns. Read a little bit about the different types of braces that are available on the market and ask yourself specifically, what are the most important things I want to get out of this treatment and what would be some things that I would want to avoid at all costs. 2. If you're considering getting braces, go in to see at least 2 orthodontists. Trust me, you will thank me later for this. And I have several reasons for this. One of them being that the orthodontic treatment takes a very long time. We're talking about years here, so you want to find a doctor that you feel very comfortable communicating with. Since you'll have to go in and see your doctor on a monthly basis, you would obviously not want to dread those appointments like it has happened to me. Not to mention that any treatment is a lot easier to take once you understand exactly what the doctor is trying to do and why. But beyond these points, there is actually a reason that may not be quite as apparent when you're just starting out your treatment. Namely, it is crucial that you feel confident verbalizing your concerns and questions during the treatment. As the treatment progresses, it is important to know that the orthodontist who is handling your care is taking your wishes into careful consideration as much as it is medically possible. And let me give you an example. I have heard of several patients who halfway through their treatment were confronted with the news that all of a sudden it has become necessary to have certain teeth extracted. After consulting a second, a third, and even a fifth opinion, they came to the conclusion that pulling those teeth was actually not only not necessary, but it was actually detrimental to their health in the long run. And then they had to confront their orthodontist who was treating them and recommending that they had those teeth extracted with the news that they refused to have that extraction performed and that they wanted to look for alternative solutions. Unfortunately, some of them were confronted with a furious orthodontist who would not listen to any kind of patient concerns. To prevent that unpleasant situation from happening, it is best if you can get a feeling for how much your prospective orthodontist is willing to listen to you and how disposed he is to harness his professional skills into getting the result that you're looking for. Reason number 3, make sure that you're getting the treatment that you are looking for. Just to make it clear, this is not a call to be presumptuous and to tell your orthodontist how he's supposed to do his job. After all, as the expert and as the person with the medical skill, it's only normal that he should have the last call when it comes to establishing the strategy for your treatment. However, that being said, there are oftentimes more than one ways to get to Rome, and it is important that your orthodontist be as mindful as possible of your wishes. And I think an example is in order. So I have really crooked and very crowded teeth. But despite that, I'm really reluctant to have any of my teeth pulled other than my wisdom teeth because I cannot quite rationalize to myself that I would have an otherwise healthy and viable tooth pulled just to have my teeth aligned. And of course I do know that there are cases when teeth cannot possibly be aligned without having some extractions. So I went in to see this orthodontist and she told me flat out after examining me that I would have to have 4 teeth pulled, 2 on the upper jaw and 2 on the lower jaw. And after that I started asking more questions and she just casually mentioned, by the way, you have an overbite and because of that bite defect your mandible is a little bit too far back but your profile is still okay. However, if you do pull those 2 teeth on the lower jawline, that will actually push your mandible back even further and that will be an irreversible change. So you will go from an okay profile with your lips closed and crooked teeth to straight teeth and a mangled profile. And I was less than thrilled with that prospect. And a short while later I went in to see a second orthodontist who, after taking x-rays and pictures and prints of my teeth and running some calculations, said that she was willing to try to straighten my teeth without those extractions. She did tell me that she cannot guarantee that everything will fall into place and that I will be able to pull a straight smile without extractions, but I actually really appreciated the fact that she was honest, she wasn't promising me the world, and she was at least willing to try to respect my wishes, as opposed to the other one who said, well, I cannot even start doing anything on you before you have those 4 teeth pulled. So needless to say, I went with the second orthodontist. 5. Try to find out, if at all possible, if there is any chance that your orthodontist may not be able to see you through your entire treatment. So for example, is his contract limited? Is he going to leave the practice within the next 6 months? In that case, you want to go with another orthodontist, because switching orthodontists mid-treatment can be difficult, expensive, and it can cause significant delays in your progress. And to wrap this thing up, here is a list of questions that you may want to ask during your first appointment. Number 1, what is my diagnosis? If you get different answers from different professionals regarding your bite, that tells you quite a bit about the professional who misdiagnosed you. 2, what results can you obtain for me? And in answering this question, you should focus on at least 3 elements. So you should ask about your smile or the alignment of your teeth, you should ask about your bite, and you should ask also about your profile. 3, are those results permanent? And what is the chance that the initial problems will recur after completing the treatment? 4, what is your treatment plan? Basically, in layman's terms, can you explain to me how you will go about fixing my teeth? 5, who will handle my activations? Will the orthodontist himself or herself do it, or will an assistant take care of it? And if you don't know what activations are, once you get the brackets attached to your teeth, you need to have them adjusted every month. Basically, you need to have either wire changed or the elastics going around the brackets changed every month, and that is called activation. At least in some parts of the world it's called that. But since every orthodontist has their own rule, it would be a good idea to ask as question number 6, how long will I have to wait between activations? And then 7, what will those activations consist of? Will you be changing my arch every month? If not, how often? And if you've never heard of an arch, that's basically the wire that goes through all of your brackets, and that's the piece that actually straightens your teeth. 8, do I need to pay extra when you change my arch, or is that included in the price of the activation itself? 9, if a medical mistake happens during an activation, who will cover the costs? So for instance, and this is something that has happened to me, if the person performing the activation will damage some of my brackets, who will cover the costs for having them replaced? I have to say that I was not amused at all when the orthodontic assistant broke one of my brackets and I had to pay for it. I don't think that's fair, and I think that if you have a chance, you should get that cleared before it happens. 10, what are your opening hours, and are there any times when you close down your practice for a prolonged period of time? And the reason you would want to ask that is if the person you see likes to go on a lot of vacations, the time between your activations may be prolonged, and that could delay your whole treatment. 11, do I have a method of contacting you in a major emergency situation? So luckily, those situations are quite rare, and definitely a bracket falling off or the wire poking you in the cheek are not such situations, as you can take care of those by clipping the wire yourself and waiting for your next appointment. But there are those rare cases of severe teeth trauma, such as would result from car accidents or falling on your teeth or violence, and I have heard of people who have gone through things like that. And in such a situation, it would be best if your orthodontist could immediately assess the situation and initialize treatment in order to minimize the negative impact. I have learned pretty late in my treatment that one of the orthodontists I'm seeing, because I'm actually seeing 2 of them, likes to take 2 to 4 week vacations 5 or 6 times a year, and during this time she closes the practice completely, leaving just an answering machine to contact her. And needless to say, apart from the very understandable vacationing patterns, everybody needs their vacation, I don't feel that I'm completely covered for all contingencies during those 4 weeks where I have nobody but that answering machine to talk to. 12. How will I clean my teeth during the treatment? Make sure that you have your orthodontist demonstrate to you what the best ways of cleaning your teeth are, as teeth with braces do have special needs and they are a lot more prone to cavities than teeth without braces. 13. How long will my treatment take? You'll probably only get an estimate, but that estimate is pretty important psychologically. 14. How much will it cost? What financing options are available, and can I see a price list of your practice to get an idea about how your services are priced? 15. Will I need to have extractions? Will stripping be necessary? 16. What side effects can I expect from this orthodontic treatment? And make sure to personalize this discussion based on your specific issues and concerns. And finally, 17. Discuss contention options, duration, and costs. So these would be my suggestions. I hope that this video was helpful. If you have any questions about braces or the orthodontic treatment in general, be sure to write them in the comments below. I would be more than happy to answer them for you. Thank you so much for watching this video. Have a fantastic rest of the day, and I hope to see you in my next one. Bye!